Welcome to Pharma Life. Let's discuss about peptic ulcer.
Please do like, share, subscribe my. Hello. In the previous video we have discussed about the peptic ulcer definition, etiology and pathophysiology. Now we'll discuss about its complications, signs and symptoms, laboratory tests, etc. Coming to the complications. So peptic ulcer complications include upper GI bleeding, perforation and obstruction. So 10 to 15% of peptic ulcer disease patients develop bleeding as complications. So this bleeding causes erosion of ulcer, and this is the reason for the black color stools and blood vomiting of the patients. And 7% of peptic ulcer disease patients develop ulcer related perforation. So this perforation is cause of increased mortality. That too, gastric ulcer perforation is very dangerous than duodenal ulcer perforation. This perforation pain is sudden, sharp and severe. So 2% of the patients developed outlet obstruction. So hospitalization is mostly due to hospitalization of older adults. Is mostly due to ulcer complications. Because older people use NSAIDs more frequently, so there is chances of ulcer related complications occurrence is more in older people. So peptic ulcer signs and symptoms include mild epigastric pain, abdominal pain, nocturnal pain. Nocturnal pain means the pain which awakes us from the sleep. Heartburn, belching, bloating, all these are often accompanied by the pain, nausea, vomiting, anorexia, etc. So weight loss is also seen in peptic ulcer patients. Laboratory tests include gastric acid studies and CBP, complete blood picture shows hematocrit and hemoglobin values decreased. This is seen in case of bleeding. Next, stool hematocrit values shown as positive. Helicobacter infection is shown positive. More than 90% of peptic ulcers are detected by upper endoscopic test. So ulcer related pain in duodenal ulcer is seen within 1 to 3 hours after meal, and this duodenal ulcer pain can be relieved by taking some food. So gastric ulcer pain is precipitated by taking food. Antacids are usually taken to provide relief, but this does not heal the ulcers or causing agents. This does not heal the ulcer. So coming to the diagnostic procedures. Diagnostic procedures include endoscopic test and non-endoscopic test. Endoscopic test include mucosal biopsy for histology and detection of urease activity. So endoscopic test, before performing endoscopic test, bismuth therapy and PPI should be stopped. Prior 2 weeks. 2 weeks prior of performing endoscopic test, we have to stop the bismuth therapy and proton pump inhibitor therapy, as this test is sensitive to certain medications. Non-endoscopic tests include serological antibody detection test, urea breath test, stool antigen test. Stool antigen test is less accurate to confirm HP eradication test. So serological test is used for to evaluate it. Serological test is limited to test the post treatment evaluation. UBT means urea breath test. This is used to check the HP urease activity. So in this test, radioactive or non-radioactive isotopes of carbon is ingested. So radiolabeled urea in the presence of HP is converted to ammonia and radiolabeled bicarbonate. This is excreted in breath and is measured by mass spectrometer. So serological antibody test is used to check HP status. UBT is a non-endoscopic test and to determine the HP eradication. So upper endoscopy and GI radiography are diagnostic tests for visualizing ulcers. First, we will go for radiography when the ulcers are uncomplicated, and then we will go for upper endoscopy. Natural history of peptic ulcer disease is a recurrent ulcer pain occurrences. So anti-ulcer medications like H2 receptor antagonists, proton pump inhibitors, sucralfate can heal ulcers and prevent its reoccurrence, but does not cure the underlying cause like NSAID or HP. Successful HP eradication, prophylactic therapy with COX-2 inhibitors decrease ulcer reoccurrence and its related complications. %20 of peptic ulcer disease patients develop ulcer related complications. So, complete eradication of H. pylori infection and treating the
The next
patient
video we
with
are going to learn about the
selective
treatment of
COX-2 inhibitors prevents the ulcer related complications.